A new medicine has been approved to help people with high blood pressure. Only about 50% of people with high blood pressure can control it with current medicines. Almost half of all people with high blood pressure don't even know they have it. Blood pressure was being controlled by medication in less than 1/4 of all women and less than 1/5 of all men diagnosed with the condition. These numbers show us how big this problem is. When doctors can't control someone's blood pressure with regular medicines, they call it resistant hypertension. This happens when a person takes 3 different blood pressure medicines at their highest safe doses, and their blood pressure is still too high. One of these medicines must be a diuretic, which helps remove extra salt and water from the body. About 20% of patients with high blood pressure have this resistant type. But resistant hypertension is dangerous. It greatly increases the risk of heart attack, stroke, and kidney failure. The condition may have no symptoms for months or years, but then can cause serious damage to the heart, brain, eyes, and kidneys. This is why finding new treatments has been so important. The prevalence of resistant hypertension is about 18 to 20% of people taking blood pressure medicines. That means about 10 million US adults have this hard-to-treat condition. These patients need new options because current medicines aren't working for them. Here's where aprocitentan comes in. This new medicine works in a completely different way than other blood pressure medicines. It's the first new type of blood pressure medicine approved in nearly 40 years that uses a brand new approach. This is approved for marketing authorization throughout the EU, including Iceland, Liechtenstein, Norway, and Northern Ireland. Applications are under review in Canada and Switzerland. The medicine works by blocking something called the endothelin pathway in our bodies. Endothelin is a substance that makes blood vessels tighten up. When blood vessels get tight, blood pressure goes up. People with high blood pressure often have too much endothelin activity in their blood vessels. This endothelin system plays an important role in causing high blood pressure and keeping it high. But most current blood pressure medicines don't block this endothelin pathway. They work on other systems in the body. Aprocitentan is the first medicine that specifically targets this endothelin system for treating high blood pressure. The medicine was tested in a large research project called the Precision Trial. This research included 730 patients from many different countries. All these patients had resistant hypertension. They were already taking at least 3 blood pressure medicines, but their blood pressure was still 140/90 or higher. The patients in the research had an average age of 62 years. About 60% were men. Most patients were white, but the research also included African American and Asian patients. About 10% were Hispanic. The average body weight was higher than normal, with a body mass index of 34. The research results were impressive. After just 4 weeks of taking aprocitentan, patients saw their blood pressure drop significantly. The 12.5 milligram dose reduced office blood pressure by about 4 millimeters Hg compared to placebo. The 24-hour blood pressure monitoring showed even better results, with reductions of 4.2 to 5.9 millimeters Hg. But the benefits lasted over time. The blood pressure reductions were sustained for 40 weeks. When researchers stopped giving some patients the medicine and gave them placebo instead, their blood pressure went back up by 5.8 millimeters Hg. This proved that aprocitentan was really working to keep blood pressure down. Wait, there is more, but do not forget to hit the like button if you have found this video useful so far. The medicine is taken once a day. The recommended starting dose is 12.5 milligram. Patients can take it with or without food. It works in combination with whatever other blood pressure medicines they're already taking. The medicine doesn't interfere with other drugs, which makes it easy for doctors to prescribe. But like all medicines, aprocitentan can cause side effects. The most common side effect is swelling or fluid retention. This happened in 9% of patients taking the 12.5 milligram dose. Another common side effect is anemia, which means having fewer red blood cells. This occurred in 3.7% of patients. Most side effects were mild to moderate. Only a small number of patients had to stop taking the medicine because of side effects. The research followed patients for 48 weeks and found the medicine to be generally well tolerated. But there's an important safety warning you need to hear. The medicine can cause serious birth defects if taken during pregnancy. Women who can get pregnant must have a negative pregnancy test before starting the medicine. They need to use effective birth control while taking it, and for 1 month after stopping. Monthly pregnancy tests are required during treatment. Because of this pregnancy risk, aprocitentan was initially available only through a special safety program. But the FDA recently removed this requirement. Now doctors can prescribe it more easily, though the pregnancy warnings remain on the label. The approval of aprocitentan represents a major breakthrough. As one expert said, "We have had to wait for over 30 years to see the approval of a blood pressure medicine that works on a new pathway." This provides real progress in treating high blood pressure. The medicine is now available in the United States and some other countries. It's sold under the brand name Trivio, but it's specifically for patients whose blood pressure isn't controlled on other medicines. Doctors will typically try other treatments first before prescribing aprocitentan. Patients who might benefit from this new medicine include those taking 3 or more blood pressure medicines at maximum doses. They should be on a combination that includes a medicine blocking the renin system, a calcium channel blocker, and a diuretic. If their blood pressure is still not controlled, then aprocitentan might be an option. The medicine offers hope for millions of people struggling with hard-to-control blood pressure. But it's not a cure-all. Patients still need to take their other medicines and follow healthy lifestyle habits. The medicine works best when combined with other treatments and healthy living. This approval marks an important step forward in treating resistant hypertension. For the first time in decades, doctors have a truly new tool to help patients whose blood pressure has been impossible to control. This could make a real difference in preventing heart attacks, strokes, and other serious complications of high blood pressure. Consult your healthcare professional before changing your medication or lifestyle. Do not forget to click the like button and subscribe. On the screen, you see an essential video for you. Thanks very much for watching this video. References are in the comments section. See you in the next video. Thanks.